It's real for so many people in so many ways. Gabe Gutierrez for us in Queens, New York. Gabe, thank you. Coronavirus has taken a devastating toll on all of us, and rural parts of this country were no exception. NBC News Now correspondent Dasha Burns joins us now from Johnson City, Tennessee. That's a community that was hit hard by COVID-19 right on the Tennessee-Virginia border. Dasha, you were there in Appalachia during the peak of this virus. Tell us what you see now and what you saw then and what you see has changed now.
Hey, Aaron. Yeah, we were here during some of the darkest times in this community. Last December, we visited this hospital, and this is one of those stories that stays with you as a journalist. We got to see firsthand what happens behind those hospital doors here at Johnson City Medical Center when we spent time with nurses in the ICUs here, and we saw the heartbreak that permeated those hallways as they were seeing patients die on every single shift. There was a mobile morgue truck parked here because the hospital had run out of room in their morgue. That is how quickly people were dying here. But Aaron, since then, this community has really turned around. They've been closing down the ICUs that they had built out during the surge. And right now, there is not a single COVID patient on a ventilator here, which is just such a far cry from what we saw last time we were here when the majority of patients were on ventilators. And it's really been a combination of several factors. They've got innovative treatments here like monoclonal antibodies. The hospital system also has a safer at home program where they're helping patients recover at home instead of in the hospital. And Washington County now leads the state in vaccinations. But it's really been the nurses here who have helped this community turn the corner from suffering to hope, Aaron.
Yeah, God bless the nurses. We don't give them enough credit. They do so much hard work. Dasha, it's obviously been a long year for all healthcare workers. What are they telling you about things as they look back now at the year past?
Well, it's incredible to talk to these nurses now and compare that to the last time we met. You can see the shift in their energy, a new light in their eyes. They say every time they close down one of those units, they breathe a collective sigh of relief. At the same time, though, Aaron, they liken what they experienced to being in a war zone. And when you come out of that, it's not just life as usual. In fact, now they sort of have that time and space to reflect, which is its own new struggle. I want you to hear from Alison Johnson. She's a nurse of 17 years. And we visited her on her family farm to better understand how she's dealing with what she's experienced. Take a listen.
Experiencing so much death and heartbreak of the families, I think that's the piece that I think, should we have done things differently, or how could we have done things better? Could we have done something different? But I feel like we did the absolute best that we could do.
And Aaron, all the nurses here tell me they still think about the families of the patients they lost. Alison still stays in touch with some of them, and they often send her messages of gratitude for being there in some of those last moments. She says the chickens on her farm gave her some therapy, were helpful in that healing process. And of course, her husband and her 2 kids, who say they're so proud of Mom for saving lives. Aaron.
That's awesome to hear. Dasha, I know that a big part of the reason that this community was hit so hard was because of a lot of misinformation about COVID. Has that changed in that area?
Yeah, Aaron, I mentioned that mobile morgue trailer that was here when we visited in December. At that time, there were actually conspiracy theories circulating through this community that that trailer was not real and that COVID was a hoax, which was such a heartbreak to these nurses who were seeing that reality every single day. And in fact, it really came down to those nurses and their stories, sharing them with folks like us in the media and also just in their communities, because they're not just in these hospitals, they're out and about. And in fact, when I talked to Alison in December, she described going to the grocery store, seeing her neighbors without masks on and worrying that she would see them in her ICU. But she says now it's a bit of a different picture. She says the community has started to take this virus more seriously after hearing those stories and after so many people here, unfortunately, Aaron, have seen that impact firsthand.
All right, Dasha Burns for us in Johnson City, Tennessee. Beautiful people in that part of Tennessee and Virginia. Dasha, thank you. Let's bring in now Dr. Anand Pare. He's the Chief Medical Advisor at the Bipartisan Policy Center.